Water is the fundamental essence of life. It makes up the majority of our body weight and is involved in every single metabolic process that keeps us alive. However, as we or our loved ones age, the relationship between the body and water changes dramatically. Staying hydrated becomes less of an automatic biological process and more of a conscious, managed effort. For caregivers and elderly individuals alike, understanding the nuances of hydration is not just about quenching thirst. It is about preventing hospitalization, maintaining cognitive function, and preserving quality of life. Dehydration is one of the most frequent causes of hospital admission for people over the age of 65. It is often a silent condition, creeping up slowly until it manifests as a sudden crisis, such as a fall, an acute infection, or sudden confusion. By understanding the physiological changes associated with aging and implementing proactive strategies, we can turn hydration from a daily struggle into a manageable, health-affirming routine. The physiology of aging, why water matters more now. To understand why dehydration is such a prevalent risk for seniors, we must look at the biology of aging. When we are born, our bodies are approximately 75% water. By the time we reach adulthood, that drops to about 60%. However, for an elderly individual, total body water content can decrease to 50% or even less. This reduction implies that seniors have a smaller fluid reserve to tap into. Because there is less water available in the body to begin with, the margin for error is significantly narrower, losing just a small amount of fluid. Through sweating on a hot day, a bout of diarrhea, or simply forgetting to drink for a few hours, can result in clinical dehydration much faster than it would in a younger adult. This physiological reality means that hydration cannot be an afterthought. It must be a priority. The vanishing thirst mechanism, perhaps the most challenging aspect of ensuring proper hydration in the elderly, is the blunting of the thirst mechanism. In younger people, the brain sends a powerful signal, thirst, the moment fluid levels drop or salt concentration in the blood rises. This signal is hard to ignore. However, as we age, the hypothalamus, the part of the brain that controls thirst, becomes less sensitive to these changes. Consequently, an elderly person may be significantly dehydrated but feel absolutely no desire to drink. They aren't being stubborn. Their body is simply failing to send the urgent notification that water is needed. This is why waiting for thirst to strike is a dangerous strategy for seniors. By the time an elderly person actually feels thirsty, they are likely already in the early stages of dehydration. Hydration must be prescriptive and scheduled, rather than reactive. Kidney function and fluid regulation. The kidneys are the body's filtration system, responsible for balancing fluids and electrolytes. With age, kidney function naturally declines. Specifically, the kidneys lose some of their ability to concentrate urine. In a younger body, if water intake is low, the kidneys will aggressively conserve water, producing dark, concentrated urine. Aging kidneys are less efficient at this conservation mode. This creates a paradoxical situation where an elderly person might continue to lose water through even when they are slightly dehydrated. Furthermore, the hormonal response that helps regulate blood pressure and fluid retention at the renin-angiotensin system becomes less responsive. This physiological decline makes it harder for the body to correct fluid imbalances on its own, necessitating external intervention in the form of regular water intake. Identifying the silent signs of dehydration. Because the thirst signal is unreliable, caregivers and seniors must rely on other indicators to assess hydration status. The classic skin turgor test, pinching the skin on the back of the hand to see if it snaps back, is often unreliable in the elderly because aging skin naturally loses elasticity and may not snap back even when the person is fully hydrated. Instead, we must look for a constellation of other symptoms. Physical signs include dry or sticky mucous membranes in the mouth, cracked lips, and sunken eyes. One of the best indicators is urine color. It should be a pale straw color. Dark yellow or amber urine is a clear warning sign. Additionally, physical fatigue, muscle weakness, and a rapid heart rate, tachycardia, can all point toward a fluid deficit. Cognitive changes, the brain on low battery. The brain is highly sensitive to changes in hydration. For seniors, one of the first, and often misdiagnosed, symptoms of dehydration is acute confusion or delirium. A senior who was lucid in the morning but becomes confused, lethargic, or agitated by the afternoon may simply be dehydrated. This sudden change in mental status is frequently mistaken for the onset of dementia or a stroke. Proper hydration is essential for the production of neurotransmitters and the overall electrical function of the brain. When fluid levels drop, blood flow to the brain decreases. Even mild dehydration can impair short-term memory, attention span, and reaction time. For caregivers, a sudden shift in cognitive ability should always trigger a fluids first assessment before jumping to more severe conclusions. The dangerous link UTIs and falls. Dehydration is a primary catalyst for two of the most dangerous events in a senior's life: urinary tract infections, UTIs, and falls. When a person doesn't drink enough, they don't urinate frequently. This allows bacteria to stagnate and multiply in the bladder, leading to infections. In the elderly, UTI is often present without fever or burning, but with sudden confusion and falls. Regarding falls, dehydration leads to a drop in blood volume, which causes low blood pressure. This is particularly dangerous when standing up from a sitting position, orthostatic hypotension. The resulting dizziness can lead to catastrophic falls, hip fractures, and head injuries. Keeping blood volume up through hydration is a key fall prevention strategy. Barriers to drinking. Incontinence, anxiety. We cannot discuss hydration without addressing the elephant in the room: incontinence. Many seniors intentionally restrict their fluid intake because they are afraid of having an accident, or because they find the urgency to urinate distressing. This is especially common in those with mobility issues, for whom the trip to the bathroom is a physically demanding or painful task. This behavior creates a vicious cycle. Restricting fluids makes urine more concentrated, which actually irritates the bladder lining and increases the feeling of urgency and the risk of incontinence. It is vital to explain this cycle to seniors. Drinking more water up to a healthy limit can actually help settle an irritable bladder, dilute urine, and reduce the risk of infection, whereas restricting fluids worsens the problem. Medications. The hidden dehydrators. The average senior takes multiple medications daily, and many of these pharmaceuticals impact hydration status. Diuretics, so water pills prescribed for high blood pressure or heart failure, are designed specifically to remove fluid from the body. While necessary for heart health, they require careful monitoring to ensure the patient doesn't become too dry. Other common medications, such as laxatives, antihistamines, and certain antidepressants, can cause dry mouth or increase fluid loss. It is crucial to review medications with a pharmacist or doctor to understand their side effects. If a medication causes dry mouth, the senior might find it difficult to swallow or eat, further reducing their fluid intake. Recognizing these chemical barriers is the first step toward mitigating them. How much is enough? Fluid requirements. The old adage of heat glasses a day is a reasonable baseline, but it isn't a scientific prescription for everyone. Fluid needs vary based on weight, activity level, climate, and medical conditions. A general medical calculation often used is approximately 30 milliliters of fluid per kilogram of body weight. For a person weighing 70 Gs and 154 lbs, this equates to roughly 2.1 liters, about 70 ounces per day. However, caution is required. Seniors with congestive heart failure or kidney failure may be on strict fluid restrictions directed by their physician. In these cases, Too much water can be just as dangerous as too little, leading to fluid overload in the lungs. Always consult a medical professional to establish a specific daily target volume for your loved one. Rethinking fluids. It's not just water. Many seniors find the taste of plain water unappealing or metallic. The good news is that hydration doesn't have to come exclusively from the tap. While water is best, milk, juice, and herbal teas contribute significantly to daily intake. Even coffee and tea, once thought to be dehydrating due to caffeine, provide a net gain in fluid if consumed in moderation by those habituated to them. Broths and soups are excellent sources of hydration that also provide sodium, which helps the body retain fluid. Nutritional supplement drinks like Ensure or Boost also count toward the total. The goal is fluid consumption. Being rigid about it being only water can lead to resistance. Variety is the key to compliance. Eating your water. Hydrating foods. We often forget that solid food contributes about 20% of our daily fluid intake. For seniors who struggle to drink large volumes of liquid, incorporating water-rich foods into the diet is a clever and effective strategy. Fruits and vegetables are the heroes here. Watermelon, cucumbers, zucchini, strawberries, cantaloupe, and celery are all over 90% water. Serving a bowl of cut fruit as a snack or adding a cucumber salad to lunch serves a dual purpose. It provides essential vitamins and fiber while stealthily boosting hydration. Applesauce, yogurt, and gelatin desserts Gel-O are also high fluid foods that are easy to swallow and digest. Strategy: the sip, don't gulp approach. Presenting a senior with a massive 16-ounce tumbler of water can be psychologically overwhelming. It looks like a chore. Furthermore, drinking large amounts quickly can induce bloating and an immediate need to urinate. The sip, don't gulp strategy is far more effective. Encourage small amounts frequently throughout the day. Keep a lightweight, easy-to-hold cup near their favorite chair or bedside. If they take a few sips every 20 minutes, they can easily consume a liter or more without ever feeling like they are being forced to drink. This steady trickle of hydration is easier on the kidneys and the bladder than large, infrequent deluges. Strategy: accessibility and visual cues. Out of sight is truly out of mind when it comes to hydration. If a senior has mobility issues, they are unlikely to get up specifically to get a drink. Water must be within arm's reach. Place pitchers and cups at the bedside, next to the TV chair, and on the kitchen table. Use visual cues to make the water more appealing. Clear glasses allow the person to see the clarity of the water, while colored cups might be helpful for those with vision impairments to distinguish the cup from the table. Adding a slice of lemon, lime, or cucumber not only improves the flavor, but makes the drink look like a refreshing treat rather than a medical necessity. Establish a hydration routine. Because the thirst mechanism is broken, we must rely on habit. Associate drinking with other daily activities. This is called habit stacking. For example, establish a rule. A full glass of water must be consumed with every medication pass, a morning, noon, and night. Other trigger points could include a glass of water immediately after waking up to replenish fluids lost during sleep, a cup of tea during the afternoon news, or a small glass of water after every trip to the bathroom. By anchoring hydration to existing behaviors, it becomes less of a battle of will and more of an automatic rhythm of the day. Managing swallowing difficulties, dysphagia. For some elderly individuals, particularly those recovering from strokes or living with Parkinson's disease, thin liquids like water pose a choking hazard. This condition, known as dysphagia, can cause fluids to enter the lungs aspiration, leading to pneumonia. This makes hydration incredibly difficult and dangerous. If dysphagia is present, hydration must be managed with thickeners. Commercial thickening powders or gels can change the consistency of water to nectar thick, oni thick, or pudding thick, making it safer to swallow. It is imperative to follow the speech therapist's guidelines precisely. Pre-thickened drinks are also available. While the texture may take getting used to, it is the only safe way to maintain hydration for these individuals. The role of electrolytes of water is essential, but water alone isn't always enough, especially during heat waves or illnesses involving vomiting or diarrhea. Electrolytes, minerals like sodium, potassium, and magnesium, conduct electrical impulses in the body. As seniors lose fluids, they also lose these salts. Drinking plain water when electrolytes are depleted can sometimes leach into a condition called hyponatremia, low blood sodium, which can cause confusion and seizures. In hot weather or illness, consider using oral rehydration solutions, so like Pediality or sports drinks diluted with water. However, be mindful of sugar content, especially for diabetics. Coconut water is a natural alternative rich in potassium. Caregiver tips, monitoring and empathy. For the caregiver, the role is one of detective and cheerleader. It involves constant, subtle monitoring. Keep a mental or physical log of how much has been consumed. Check the toilet bowl for urine color if possible. Watch for dry lips. Crucially, approach the subject with empathy. Nagging a senior to drink can lead to agitation and refusal. Instead, make it a social activity. Sit down and have a cup of tea with them. Say, "I'm feeling thirsty. I'm going to have some water. Would you like to join me?" Making it a shared experience rather than a command. Toast to good health. Make it pleasant, not punitive. Conclusion: a small change for a big impact. Hydration is arguably the simplest, most cost-effective medical intervention available for the elderly. It doesn't require a prescription. It has few side effects when managed correctly, and it impacts every system in the body. From preventing falls and infections to clearing the fog of confusion, water is powerful medicine. By understanding the physiological hurdles of aging, the loss of thirst, the kidney changes, and the medication interactions, caregivers and seniors can work together to build a hydration habit that sticks. It requires patience, creativity, and vigilance, but the reward is a healthier, more alert, and more resilient life in the golden years. Let's raise a glass to that.